My name is Scotty Miller, and I'm going to be talking today about the socially isolated, elderly, living alone, vulnerable population and the influence of environmental and cultural factors. So first off, I'm going to talk about some basic health risks that elderly living alone are facing. Now, these are elderly individuals, so there are many pre-existing physical, psychosocial, and economic concerns before we even begin to start talking about the living alone dynamic. So what does that mean when we're looking at a population that already is vulnerable and at risk, then to make them socially isolated? So physically, these people are suffering from several chronic conditions requiring different doctors and specialists without any help to manage all these symptoms and medications and appointments. This means some symptoms get missed completely because they don't have someone who is watching them every day and seeing changes. Also, they're at an increased risk for medication errors without someone who is there to help care for them and keep them on track. These individuals are at a huge risk for depression and anxiety secondary to their social isolation. Chronic pain, debilitation, perceived burden, losing friends and loved ones, lack of emotional support, all of these put individuals at an increased risk. Finally, economically, according to Pew Research Center, older adults living alone are twice as likely as those who live with others to say that they don't have enough to meet basic expenses. Also, this population was found to be 3 times as likely as those who live with others to be poor. These individuals are on a fixed income, they're living longer than previously, which means that their retirement funds are no longer adequate to see them through to the rest of their lives. Also, they are on a single person income, which increases their likelihood of poverty. Now we're going to dive into the cultural influences that can either help or hinder this population. So first up, the media. A common portrayal of the elderly are that they are of low status and incompetent, and this is a common theme running across media representations. They're often depicted as weak, unattractive, and senile. Other cultural stereotypes often seen in the media portray the elderly as frail, feeble, financially distressed, and not contributing to society. These representations can be particularly harmful to the elderly living alone population. This negative portrayal affects how people treat them, what they expect from them, and most importantly, how they see themselves, which can set these individuals up for even higher risks of depression and other health factors. The influence of family support can be a large determining factor in establishing risks for the elderly living alone population. If they have adequate support, they can actually stay independent longer. They have someone to check on them, and they have help when they need it. Supportive families that are active in these individuals' lives can help to combat the loneliness and social isolation and be a resource in times of need. Similar to family support, if the elderly living alone individual has a strong group of peers or social interaction, it can negate isolation risks. Socially engaged elderly individuals are at decreased risk for depression, heart disease, and malnutrition. Having a strong group of peers boosts self-esteem and purpose as well. So when we talk about the cultural factor of cyclical nature, in terms of can social isolation be passed on through the generations? Not really. But having a supportive family who takes care of their elders can be something that is passed down from generation to generation. So, in a sense, it can be cyclical, but the cycle can also be broken. For legal and political system, statistics show that elderly people are less likely to report fraud and other crimes. This can happen because they don't realize they have been the victim of a crime, or they could be embarrassed and scared that someone will think that they are no longer capable of caring for themselves and need a guardian appointed. In terms of political, Since Medicare was established in 1965, the elderly have better coverage for healthcare and prescription drug coverage, but the socially isolated component means that they still have difficulties with accessing these services. Cultural beliefs centered around aging can be a potential barrier for the elderly living alone population. Can have a strong influence on how they view themselves. In America, there's a strong cultural belief tied around independence and productivity, which can make the elderly resistant to asking for help and also contribute to feelings of worthlessness when they're not producing as highly as they were when they were younger. In Asian countries, the elderly are respected and revered, and these contribute to higher senses of worth and individual self-esteem for these people. So tied in with that on the international level, the cultural influence, I really liked this map because it not only shows percentage of population age 65 and older today, but it also shows projected numbers for 2050. It's a really good visual indicator of just how rapidly this population is growing. So these are not just living alone individuals, but we do know that in the United States, a third of older adults living outside of nursing homes are living alone. Currently, America has 11.3 million elderly individuals living alone. We can also see here that wealthier countries seem to have higher rates of elderly, and this could be for several reasons. Access to healthcare, which means that people are living longer, and also funding for programs such as public health and accessibility programs. Typically, wealthier countries are better able to assist this population as a whole. Now we will discuss different health disparities related to the elderly living alone population. This graph shows that 12% of elderly living alone don't even have enough to meet basic expenses, contrasted to only 5% of elderly living with others. So this increased risk of poor socioeconomic status can influence all areas of their lives. Do they have enough funds to get groceries or medications or reliable transportation to and from doctor's appointments? Not having enough money to meet basic needs also significantly increases stress on these individuals. According to the Institute on Aging, living arrangements differ by race and ethnicity. Older non-Hispanic white women and Black women are more likely than women of other races to live alone, which is 39% compared to 21% of Asian women and 23% of older Hispanic women. So this can largely be attributed to cultural views on aging and traditions of caring for older generations in the family. Religion has been found to provide the several psychological benefits for the elderly living alone population. It gives them a positive and hopeful attitude about life and illness, which predicts improved health outcomes and lower mortality rates. A sense of meaning and purpose in life, which affects health behaviors and social and family relationships, and a greater ability to cope with illness and disability. Many older people report that religion is the most important factor enabling them to cope with physical health problems and life stresses. In one study, greater than 90% of older patients relied on religion, at least to a moderate degree, when coping with health problems and difficult social circumstances. For example, having a hopeful, positive attitude about the future helps people with physical problems remain motivated to recover. People who use religious coping mechanisms are less likely to develop depression and anxiety than those who do not. This inverse association is strongest among people with greater physical disability. Even the perception of disability appears to be altered by the degree of religiousness. Of older women with hip fractures, the most religious had the lowest rates of depression and were able to walk significantly further when discharged from the hospital than those who were less religious. Religious people also tend to recover from depression more quickly. So, in terms of gender, females are at a significant increased risk than males to be elderly and living alone. The Institute on Aging reports that in 2010, 57% of all adults aged 65 and older were women. 2/3 of Americans age 85 and older are women. So women live longer than men, and for this reason, they're twice as likely as older men to live alone. That's 37% of older women live alone compared to 19% of men. In 22, 72% of older men lived with a spouse, while only 42% of older women did. This map is from Census Scope and shows the percentage of the country's residents 65 and older living alone here in America. So there's definitely an influence on geographical location as a determination of living alone. This could be because there are programs and outreach available that make certain areas easier to stay independent, or it's more acceptable and manageable in these areas. In terms of bias towards elderly living alone population, they do suffer from both implicit and explicit bias. An implicit bias here in America would be the belief that it is dangerous for an elderly individual to live alone. This cultural belief can influence behaviors toward the elderly and their attitudes about themselves. Explicit bias could express itself in terms of the belief that old people are bad drivers and shouldn't be allowed to drive. Both of these biased behaviors can be harmful and increase the health risks for this vulnerable population. Where these individuals live in the world can have a profound influence on their health risks due to cultural and familial belief systems. For example, in China, they have elderly rights law where elderly individuals have established visitation schedules from their children and grandchildren, which ensures social interaction and connection. In Singapore, elderly individuals can sue their children for allowance, which then helps to increase their socioeconomic status and negate some risks as well. In the Mediterranean and Spanish cultures, it is common for several generations to live under one roof, which would eliminate the risk of living alone entirely. So in conclusion, the elderly living alone population is a unique and high-risk population that is growing rapidly. The reason that they are at increased risk is due to their social isolation and difficulties with access. We as healthcare providers can help to assist this population by providing resources and education when available. We can also help by decreasing bias, both implicit and explicit, and encouraging these individuals to maintain their independence in the healthiest and safest way possible. Thank you.